Hello, my name is Shaina Pierce, and today on Health and Wellness, we'll be sitting down with Mr. Robb Reichard of the Philadelphia AIDS Fund to learn a little bit more about the HIV/AIDS virus. What is it exactly?
Well, HIV is a virus that basically attacks your immune system. And so it uses the immune system in order to replicate. And so the very thing that would normally fight off a virus is compromised. And so people living with HIV who are in treatment, their immune system becomes weaker and weaker over time. And eventually they'll develop what we consider AIDS, which is when they start to have symptoms or opportunistic infections as a result of their immune system being damaged.
So once a person contracts HIV/AIDS, how long will it be in their system before it's able to be detected?
Well, under the current tests, and we keep improving these tests, but it takes 2 to 4 weeks right now with most of the testing that is available.
So can you tell us a little bit about the Philadelphia AIDS Fund? What is your mission here?
Sure. Our mission is to raise funds for HIV and AIDS services here in the Delaware Valley. And so we serve the entire region in Philadelphia, greater Philadelphia region. And our mission is really to help organizations with funding to supplement the government dollars that they receive. Or in some cases, our dollars are the prime source of their funding for their programs.
Okay, so in recent years, many organizations have been founded with the sole purpose of providing what you can say a sense of support to those victims with HIV and AIDS. What type of support services do you offer to your patients and even their families here at the Philadelphia AIDS Fund?
Right. We don't actually offer any services. What we do is raise awareness about the epidemic. So we are the local affiliate for the NAMES project, the AIDS Memorial Quilt, which we take out to colleges and universities, high schools, churches, community events to raise awareness about the epidemic. And the quilt is a wonderful way to do that. It is a memorial to loved ones lost, but it's a beautiful piece of artwork. And so it's a great way to start a conversation about HIV and AIDS. We also do a program we call our 1981 Until It's Over timeline, which is a history of the epidemic. It's a sidewalk timeline, and it's a walkthrough of different things that have happened over the past 35 years of the epidemic. So those are just some of the ways that we raise awareness about the epidemic. And then we raise funds to support services or things that aren't government paid for. For example, some of the programs we support are summer camps for HIV affected or infected youth. We also do an annual toy drive where we collect over 800 toys for HIV affected and infected children. So those funds that we raise help to support the organizations who are providing the direct care to services.
Would you say that there are still stigmas associated with the disease?
Oh, absolutely. You know, the Kaiser Family Foundation does an annual survey about HIV and AIDS and about Americans' attitudes around the epidemic. And their most recent survey showed that 44% of Americans are uncomfortable with the idea of having their food prepared by somebody who's HIV positive. You know, and which is absolutely ridiculous. There is no chance of somebody becoming HIV infected because their meal was prepared by somebody who's HIV positive. And we're 35 years into this epidemic, and that misconception still is out there. People still have that fear, and you know, that fuels stigma.
What are other misconceptions about people with the HIV/AIDS virus?
I think that a lot of people feel that they would recognize somebody. We often, people will refer to people who are HIV positive as dirty, you know, and people who are HIV negative as clean. So those kinds of stigmas just fuel the epidemic. You know, stigma keeps people from talking about HIV with their partners. It keeps people from going and getting tested. And in some cases, it even keeps people from getting services when they are living with HIV because they don't want to go to the doctor. Or if they live in a small town, there's only one clinic and they don't want to go to that clinic and have people, their neighbors, find out they're HIV positive.
So it seems that many of these stigmas actually stem from ignorance. Could you possibly share the ways in which HIV/AIDS can be transmitted?
Sure, it's transmitted through blood, semen, vaginal fluid, and breast milk. And the bodily fluid needs to get into the bloodstream. In the United States, most of the transmissions are through sexual contact and sharing intravenous needles. So those are the primary ways today that HIV is transmitted.
Okay. What is your organization doing to dispel these stigmas and stereotypes?
It's a constant challenge. We make small incremental progress in that, if you had asked the question about having a meal prepared 30 years ago, the percentage would have been much higher. But it's a constant just educating people, educating new people, because we have a new generation coming up that needs the information also. And then, what we're seeing is as more people know people and more people are, more celebrities come out as HIV positive, what we see is an uptick in people getting information. Charlie Sheen, when he came out as being HIV positive recently, we're seeing what's happened is more people Google searches around HIV, more searches around HIV services, more searches around HIV medicines. And so there is an uptick in education that happens when that conversation gets started.
So in the past few years, what type of advances have been made for treatment and for screening for people with HIV/AIDS?
Sure. Well, there's advances on several fronts. We've seen testing become quicker, less invasive, and getting the results faster. If somebody is on treatment successfully, and they have their viral loads suppressed to undetectable levels, they are unlikely to transmit the virus to somebody else. So most of the new infections that are occurring out there are people who either don't know they have HIV or for some reason aren't in the care system. Which is wonderful news that if we can get people into care and treatment, they're unlikely to spread the virus. The problem is, in this country, only 30% of people fall into that category. And so 70% of people living with HIV either aren't getting services and aren't getting the medical services they need to keep their virus undetectable, or they don't know they have the virus. So that's the challenge that our organizations face here in the region. The other thing is on the prevention side. We now know that one of the HIV medicines, somebody who's HIV negative takes, and the one that's been approved is Truvada. Somebody who's HIV negative takes that one pill a day, they virtually eliminate their chance of becoming HIV infected. And which, it's not the vaccine that we would like to have, it would be a one-time shot. That's what our goal would be, to get that. But it is something that we can offer people who are at high risk for HIV to keep them from becoming infected.
And I also am aware that throughout the year, your organization hosts several events to both raise awareness and raise funds for HIV/AIDS. We talked a little bit about the toy drive earlier, but could you just maybe tell us a little bit more about the ways in which your organization raises funds that helps contribute to research, patient support, and even treatment of the disease?
Sure. Well, our founding was the AIDS Walk. We produced the Philadelphia AIDS Walk. This coming October, we will be holding our 30th annual AIDS Walk in Philadelphia. So AIDS Walk Philly is our biggest annual event. And we get thousands of people out to support and raise funds. It is a pledge-a-thon, so we have our fundraising ambassadors who are going out, participating as walkers or runners, and raising funds for HIV and AIDS services, and public awareness efforts and education. And then we have our monthly gay bingo events, which are very hard to explain. It's drag queens who host the event, And so they make it a fun and raucous time for our players. And we get anywhere from 500 to 700 people every month out to play bingo. And we've been doing that for 20 years. We'll have our 20th anniversary in June of that event. Then we spun off a black tie gay bingo event, which is an annual gala with dinner and dancing and a silent auction and all the things you think of traditionally in a fundraising event, with gay bingo layered on top of it. Again, hosted by our bingo verifying divas, who are wonderful volunteers who, get dressed in drag to come out and entertain our audience.
So how would you say that your services and fundraisers benefit people outside of the Philadelphia region?
Well, our gay bingo, I'm quite proud to say, is a model around the country. We have one of the longest and most successful running gay bingos in the country, so we oftentimes get phone calls from other cities saying, hey, can you help us, figure out how to do this, in our town. And so I think that's one of the ways. And I think, just being in one of the largest cities in the country that has historically been, high impact with HIV. Our role does affect what happens because, one thing that HIV has taught us, if it's taught us anything, is that viruses don't stay in any one community.
What do you believe would be the most valuable piece of information that the general public should know in order for them to not only raise awareness for the cause, but be able to prevent it in other situations?
My biggest thing, I think, today is that almost every American knows somebody who's HIV positive. They probably don't know it because of the stigma. And so people who are HIV positive often keep that information to themselves because they are afraid of the stigmas that they'll face. But people do around them have HIV, and they're living long, normal, healthy lives with the virus if they're able to get into medical treatment. And so that's one of our challenges. But there's a lot of people walking around with HIV every day, work, and that they're working with, they're in their family, that they don't know are HIV positive.
This concludes another segment of Health and Wellness.